Good evening, everyone. Welcome to the latest edition of Optima Facebook or YouTube Live. So this is a monthly session that we have to address common topics, health-related topics, which will be of interest to most people. And we try to clear a lot of health misinformation and myths which are generally roaming around. So today's is a very interesting topic. The title itself is quite interesting. It's called Heal Your Heels. And to help us understand about this topic and to educate us about this topic, we have consultant physiotherapist, Dr. Shivraj. Welcome, Dr. Shivraj. Thank you for coming.
Hello, good evening, everyone.
So we will be discussing about the heel pain, and Dr. Shivraj will be informing us about different aspects of this condition. And during that time, please feel free, whoever is watching, to put your doubts in the comments section where you're watching, and we'll try to address those doubts either during the session or after the session. So let's dive right in. So what are the causes of heel pain, Dr. Shivraj?
Yeah, so heel pain usually arises from one particular tissue is there, which is in the heel. Okay, so heel is a bone, which is calcaneum, and its pain is coming because one soft tissue is there, which is called plantar fascia. So that plantar fascia is getting inflamed or some irritation is happening over there. So because of that, we'll get usual heel pain. So there are so many causes of heel pain and some symptoms also are there. So by symptoms, we can get to know which kind of pain is there because heel pain can be so many types, but particular this pain is because of plantar fasciitis because plantar fascia is getting inflamed or some irritation is happening over there. So
So
that will
plantar
be
fasciitis is the most common cause of heel
on,
pain,
yes,
isn't it?
yes,
Okay, so when you say plantar fascia,
hmm,
like I know what it is, and many medical people know it what it is. But do you have a diagram, or can you explain what plantar fascia is to the general public? I mean, so that they have a idea about what it is that we're talking about.
yeah, absolutely. I have some anatomy video which will give some idea to general population what is the plantar fascia and what kind of structure it will look like and what kind of things will be there if it is getting inflammation or some pain. Okay, so I will just share that video. So this yes. So as you people can see in this video, this is plantar fascia which is supporting your whole body weight as well as this is start joining at the fingers and it is ends in this calcaneum bone over there. It is attached over there. So yeah, exactly over here.
So the lower part, the one which is below the foot, right? That
Yes,
white kind of structure, which is going from the toes till behind, and
yeah,
you can see that it's going there. So that is the plantar fascia, and
yeah,
it will behind part where it attaches into that bone. That is where it is usually irritated or inflamed, and that is what
yes,
causes plantar fasciitis.
yes, yes,
Am I right?
yes, sir. Exactly. So
Okay.
this area exactly. Yeah.
Okay. Thank you for sharing that.
Yeah.
So, what causes plantar, like who develop plantar fasciitis? What is the situation in which plantar fasciitis occurs, and what are the causes that lead to
Yeah.
plantar fasciitis?
So as we understood in this video, plantar fascia is attaching to the bone calcaneum. So whole body weight is coming and transferring through the plantar fascia. If we are walking, climbing stairs, jumping, running, or any kind of sporting activities, also we are doing that whole body weight is transferred from this bone, and plantar fascia is mainly absorbing lot of shocks and it is protecting our legs muscles and all the structures surrounding structures by absorbing lot of shock. So it is fascia which is thick band kind of structure which is absorbing lot of shock absorption and it is protecting our bones and other muscles. Okay, so most of the time whoever having little overweight like body weight is too much or their plantar anatomy is different, like flat feet, which like reduced plantar arch or exaggerated plantar arch. That kind of peoples also are very prone to this kind of pain. And other occupation related things, most of the military persons, which like peoples are doing marching and kind of stuff, and some sporting related activities like running and some hard surfaces, peoples are playing on hard surfaces, then they'll get a lot of irritation in this plantar fascia if surrounding muscles or surrounding structures have any imbalance or some weakness or any other issues in surrounding structures.
So, okay, so basically it's acts like a shock absorber, and
Yes.
therefore plantar fasciitis is more likely to occur if there is a lot of stress or a lot of injury that comes onto it because of increased activity like marching or running. Nowadays, marathon running is very popular, so many people are participating in that. So they also need to be aware that they can develop plantar fasciitis. So if the stress is more, then also you can develop on stress, meaning load force
Load.
on the heel is more, then also you can develop plantar fasciitis. Otherwise, if the weight is more, right, if the person
Yes.
is overweight, then also the load is more and therefore they can develop. Or if the structure of the foot, the shape of the foot, if it is flat or if it is too much arched, right, then
Then
also
also
the lot of weight can come onto the plantar fascia, and that is also another situation. So either increased work, increased weight, or abnormal structure of the foot. So these are the three situations in which you can develop plantar
yes,
fasciitis.
most commonly. Yeah.
Okay. So when you develop plantar fasciitis, right, you have heel pain, right?
Yeah.
That is what we are discussing about today. But what is the kind of heel pain that we have, and what is the impact that it has on your day-to-day living? And does
Yeah.
it really, is it something which is very bothersome or something which can really affect a person's, life in any way? So, what are the problems that you can face due to plantar fasciitis?
Yeah, so plantar fasciitis is very common condition. Like every 10 out of 10 people, one people might get this kind of pain in their lifetime. So plantar fascia will give you, particular pattern of pain. So pain perception will be very sharp. So pain will be very sharp in nature. But most of the time when you are walking in the morning, so whenever you are waking up in the morning and start taking some few steps, at that steps you will get maximum sharp pain at the heel, okay, base of your heel, or other like medial, which is inside of your heel, okay. And next thing is like whenever you are walking or doing some activities, running or walking kind of, at that time initially you will not get pain, but once you stop walking or running kind of activities, after few minutes or some time later you will start getting that pain again. So that is suggesting like whenever you are waking up in the morning, because you are sleeping 7 8 hours, your leg is not moving. So because of that, some stiffness will develop in the plantar fascia, and once initial weight bearing will happen, the tissue again get little irritation, and you will get that sharp pain. And most of the activities like running or walking, whenever you are doing, because running and walking will involve some movements, so because of that movement some heat will generate, so that heat will give some relief. But once you take rest from walking or running, that heating is going away, and that pain will reoccur, like it will be sharp in nature and it will give you too much of pain. So that 2 3 symptoms are there by which we can get to know whether this is plantar fasciitis pain or any other kind of heel pain. We can
Okay.
do some diagnostic processes also, like if that pain is persisting from so long or chronic in nature, we can consult a doctor, take some ultrasound scan. Ultrasound is most widely used to diagnose plantar fasciitis. Otherwise, at home also there are some certain tests which you can perform at home and get to know whether this is plantar fascia pain or not.
Okay,
So
that was
that.
interesting. So, meaning that lay people, meaning people who are not medical professionals, they can do some tests on themselves and find out whether they have plantar fasciitis or not. Is
Yes.
it?
Yes, yes.
So, can you mention any such test, or that people who are watching, if they are concerned about whether they might have plantar fasciitis, that they can test by themselves and know whether they have plantar fasciitis or not?
Yes. So this test will not clearly give you idea whether exactly this is plantar fascia or not, but you can get to know whether any associated reasons are there which is giving you this kind of pain. So one of the most common reason is to like reduce your ankle mobility. Means your ankle joint is not moving like normal ranges are there. In that ranges only ankle should move. So usually what happens if your calf muscle is tight or some other structures are imbalanced, your muscle are not in balance, then your this ankle mobility will get affected. So to measure ankle mobility and get idea whether your plantar fascia is tight or surrounding muscles are tight, we can get an idea that on which particular area we have to focus or from where we can start working that it will give some relief in the pain.
Oh,
So to get start, we can do that test at home. So I'll just share you the video of the test, which will give us idea. Okay, so this is the deep lunge. Okay, so I'll play this video. So you have to take one measure tape at home. So you have to, whatever is showing in the video, you have to keep your thumb at the 10 centimeter from the measure tape from the wall. You have to keep your thumb over there, and from there, back side of knee will be completely straight. And make sure your heel is not lifting while doing this test. Okay, so at 10 centimeter, if you are starting and heel is lifting, that suggests your ankle mobility is 10 centimeter. Okay, so you have to keep checking this multiple times on different lengths. Like once you are starting at 10 centimeter and your heel is not lifting, then you should go for 12 centimeter or 11 centimeter. So at the exact point where your heel starts lifting, that point will count that much centimeter you have ankle mobility. So if your ankle mobility less than 12 or 13 centimeter, then you should consider that your ankle mobility is quite reduced, and you should focus to increase your ankle mobility in the future.
okay, that's very interesting. Thank you for that. So, in addition to that, we have some questions coming in. So, Shilpa asks that how can I differentiate between plantar fasciitis and regular heel pain? So, I think Dr. Shivraj answered that initially. He said that plantar fasciitis is the most common cause of regular heel pain, right? So, if you are having regular heel pain, then it is most likely plantar fasciitis itself. And to confirm that, as he said, you can get yourself examined by a physiotherapist or a doctor. And the test which helps us to confirm, the easiest test and one of the most best test is to do a musculoskeletal ultrasound investigation. And that will show that if there is swelling in the plantar fascia, that will confirm that the pain that you're having, the heel pain that you're having, is due to plantar fasciitis. But de facto, most common cause of heel pain is plantar fasciitis, and therefore, if you have heel pain, then it's most likely plantar fasciitis. Raj is asking about recovery. We'll come to that, Raj. We're still talking about the condition and how it impacts a person's life. So, Dr. Shivraj, you were saying about the symptoms that the patient with plantar fasciitis faces. So you said that usually when they're a little bit active, the problem doesn't bother them too much. But then in the morning when they get up, or even after a brief period of rest, they can have a lot of pain and difficulty in moving their joints, in their ankle joint, basically difficulty in walking. So is that the only problem that patients face, discomfort, or does this lead on to any other serious problem or any serious condition or situation?
Yeah, so if plantar fasciitis is in chronic in nature, then continuous irritation is happening at the base of where this plantar fascia is inserting or means ending. So that irritation leads to complete rupture of plantar fascia. It can give surrounding structures also some damage if it is in chronic in nature, or it will give you a lot of difficulties in your daily activities like walking, running, climbing stairs. All these kind of activities you will face a lot of difficulties because it is chronic in nature and it will take some time to heal also, because your whole body weight is continuously coming on that heel and continuously irritation is still happening. Okay, so you have to address the issue, you have to start working on that, and you can consult good physiotherapist or any orthopedician and start managing it very well.
So, uh, when you say that we have to start managing plantar fasciitis, generally, before a patient comes, because many people watching this uh, uh, might have heel pain, might have plantar fasciitis, and in uh, many situations, like as you said, in some situations it might be really severe, it might be chronic, but in some situations it might be just very mild, or it might have just started, right? So, what are the things that people can do at home, sort of, to prevent them from developing plantar fasciitis, or if they have developed plantar fasciitis and heel pain, and it is very mild, is there something that they can do at home to manage it by themselves, like
Yes,
without having
absolutely.
to come to meet a doctor or a physiotherapist?
Yes, yes. So if you have any mild symptoms, which is also you will get some severe pain in the morning. Severe in the sense it will be not very light. You will feel some difficulty to take initial steps. So that is not mild pain. It is bothering, but in initial stage of plantar fasciitis also you will get that kind of symptoms. So to manage it at home, there are multiple ways which you can do. Is there are multiple exercises or some plantar fascia rolling or some. So I'll share you the video. You can see the video and take steps accordingly.
Okay, so you're saying that basically, one of the important things that people can do if they have plantar fasciitis is that they can start off with certain exercises at home
Yes, yes.
itself, right?
So first and most important exercise, if you are getting early morning pain when you are waking up and initial steps you are taking, so there is one nice stretch which is very easy and it will take hardly 15 to 20 seconds and your pain will be much better. So this is plantar fascia stretch. So you have to sit, you have to crisscross your leg, you have to hold your fingers and base of your fingers and heel with both the hands. You have to stabilize it and then you can start stretching it. You can stretch it for 10 seconds and do 3 to 5 repetitions. If you are doing this regularly in starting of your symptoms only, then you can avoid this to turns into chronicity or long time problems in your early morning walking or any daily activities also.
Excellent, excellent. Thank you, Dr. Shivraj. That was, I hope that will be very useful for everybody who's watching. So anybody who has mild symptoms and wants to take care of the problem, they can do it very easily by doing the plantar fascia stretch, which Dr. Shivraj just demonstrated, where you hold the heel with one hand and the base of the toes with the other hand, and then you stretch it. And you hold that for 10 seconds, am I right? And you do three
Yes,
to
yes.
five repetitions.
3 to 5
Okay,
repetitions.
so that's a very easy and short exercises that you can do. Apart
Mhm.
from exercises, are there any other precautions or any other, uh, things that people can do to either prevent plantar fasciitis, or if they have very mild plantar fasciitis, to treat it? Is there things that people can do at home?
Absolutely. So if you have any mild symptoms also, or if you want to uh, uh, manage it and don't want to make it little more chronic, then initially you can start doing these stretches. Otherwise, if you have any postural or any muscular imbalance, then you can visit physiotherapist or nearby doctors. And third thing will be your footwear also affects a lot. So if your footwear are very firm, or you are walking on very firm surfaces, or your footwear is very, not in proper shapes or cushioned, then again it will irritate your plantar fascia, and again it will increase your pain. So your footwear should be comfortable. It will be medium firm, not too soft, not too hard also. And your nowadays, like, there are so many footwear insoles are coming, which is, providing lot of support to your arch also, plantar arch. So that arch support shoes also you can start wearing. So that kind of small things will leads to, managing it very better way, and we can prevent to, turns into chronic pain.
Okay. So I think that answers your question, Chandrika. Chandrika has asked, can wearing high heels or flat shoes cause plantar fasciitis? So I think Dr. Shivraj answered that footwear has an important role in the causation of plantar fasciitis and also in the treatment of plantar fasciitis. And where wearing high heels or even flip-flops can also, like chappals can also, hard chappals and high heels, that can also increase your chance of developing plantar fasciitis. And to prevent that, or even if you have heel pain or plantar fasciitis, then the best thing to do is to either get a proper footwear which is medium soft, or if you don't want to buy a new footwear, you can use what are called as insoles. So you can buy these are available in most chemist shops. So they are soft structures which can put inside your shoe, and they will act like a cushion between your heel and the shoe. So you don't need to change your footwear, but you can modify your footwear so that it can help you with the preventing and with respect to the treatment of plantar fasciitis. So now coming to the question which Raj had asked, how long does it usually take to recover from plantar fasciitis? Dr. Shivraj.
Yes, so it always depends on your condition. So there are totally, from how long you are having this problem. So that will decide your chronicity of the, already present issue. So if it is acute, in the sense, if it is started recently only, like within few days or few weeks, then it can be cured very, within 1 or 2 weeks of exercises of some correction or changing of footwear. But if it is in chronic in nature, like it is persisting from last 3 to 6 months, or older than that, then it might can take a little longer time, because chronicity always leads to further muscular changes or muscular imbalance or some postural issues also. So maybe your calf muscles will be tight, or surrounding structures like muscular weakness will be there, or some knee related muscles or some hip related muscles will be imbalanced. That can lead, more and more load to the plantar fascia, and it can increase the chronicity of the disease.
Oh,
So to reduce chronic plantar fasciitis, we have to start working on multiple factors. We have to assess and check proper muscle strength, every muscle strength of your hip, your knee, and your ankle joint. We have to check mobility of each and every joint. We have to, get detailed assessment of your every movements, surrounding joints and everything. So that might can take some around 4 to 6 weeks of time to get some relief from the pain. But long term management depends on the findings, whether how, bad your muscular imbalance or how tight your muscles are. So depending on findings, we can decide the timelines of the recovery of the plantar fasciitis.
okay. So I hope that answers your question, Raj. So one thing that Dr. Shivraj mentioned is exercises, and definitely we cannot emphasize enough the importance of exercises in the management of plantar fasciitis, particularly with respect to if it is chronic plantar fasciitis, meaning if the plantar fasciitis has been going on for a very long time, then all the other muscles around the plantar fascia and around the ankle, they are likely to become weak, and therefore those also need to be worked on, and therefore it can take a little bit longer time to get better. But exercise is the only, exercise is one of the most important components of the treatment of plantar fasciitis. Along with that, Dr. Shivraj also mentioned about orthotics, meaning things that you can use with respect to your footwear. So basically things like insoles, soft insoles, which you can insert into your shoe so that it provides a cushion between your heel and the shoe. And of course, choosing the footwear appropriately, making sure that you're not wearing high heels or hard, flat chappals. So those are the things which can increase your chance of developing plantar fasciitis. And if you already have it, then it can worsen the plantar fasciitis. So Shrinu asks that can children and adolescents also develop plantar fasciitis? And if so, is the treatment different?
So children's and younger populations are, very less likely to get plantar fasciitis. Especially plantar fasciitis are more common in age group of 40 to 60 years. But sometimes if adults, kids and all this plantar fasciitis is very, less occurring thing. But adults who are using high heels or using some different footwears or running on hard surfaces for longer distances kind of activities, then they might get this kind of plantar fasciitis pain and all these things.
Is
But
it
in kids, it's very less likely. If kid is coming with some ankle related deformities like rheumatoid arthritis or kind of early diagnosis arthritic things, then they might get this kind of pain. But kids and adults is very less common. Mostly it will occur in 40 to 60 years of age group.
is the treatment different in kids if they develop plantar fasciitis? Is the treatment different compared to adults?
So if it is coming, plantar fasciitis have many reasons to come, but if it is coming because of some difficult deformity, which is primary disease is giving some deformities, then we have to cure accordingly. We have to work on the deformities first. We can put some hard uh, orthotics kind of things, which will splinting will help to reduce the deformity. Otherwise, if it is severe in nature, then we can take some consultation from the surgeons to move forward how to manage better with medications or surgery is option or not.
Okay, so
So
basically in children, they are much less, and young adults, they are much less likely to develop plantar fasciitis. And if they do develop plantar fasciitis, it might be due to a deformity or a change in the shape of their foot or ankle. And therefore, the treatment will be different in them because you'll be working predominantly on correcting that shape problem first,
yes,
rather
yes.
than focusing on the plantar fasciitis. Thank you. Thank you, Dr. Shivraj, for that answer. So now Dr. Shivraj, as I said, mentioned about exercises, which is very important in the management of plantar fasciitis. And of course, orthotics and footwear was also mentioned. The next thing that we usually use is medications, and there rheumatologists and orthopedicians are generally involved, and the medicines can broadly be divided into three categories. One is what we call as painkillers. So these painkillers, they not only reduce pain, but they also reduce inflammation or swelling. So as Dr. Shivraj was saying, in plantar fasciitis, patients will usually have a swelling or a inflammation at the place where the plantar fascia attaches into the bone. And therefore, these medications can reduce that inflammation and reduce the pain and discomfort that the patients experience, and therefore make it easier for them to do the exercises and help with the healing of the problem as well. So, but it's usually recommended for a short course because, as we all know, painkillers is not something that we like to give a lot of for a very long duration. And it's considered complementary to exercises, right? So, to help with respect to the exercises. In some people where the pain is very severe and it is troubling them, then we can give a local injection of corticosteroids. So that usually reduces the inflammation and swelling and reduces the pain also and makes the patient comfortable. However, this has to be done carefully because sometimes the corticosteroid can weaken the plantar fascia, and patients can it can cause rupture or breakage of the plantar fascia as well. And the third type of medication is something called as platelet-rich plasma. So that has nowadays become a bit popular, and that also acts in the same way. A local injection is given, and that local injection helps to reduce the inflammation and swelling which is there, and therefore it reduces the pain and helps the patient to do exercises. So this is with respect to the medications or the medical management of plantar fasciitis. Is Pramila is asking, is surgery an option or surgery required for the treatment of plantar fasciitis? Dr. Shivraj.
So plantar fasciitis is a tissue which is getting inflammation. So inflammation doesn't leads any kind of surgery. Okay, so it is very curable by home remedies like giving some rest or taking some rest, doing some exercises which is bothering the issue like muscular imbalances or whatever things are there. But usually for plantar fasciitis, we doesn't require surgery in rare cases where the plantar fascia is ruptured or some bony disturbances is happening or some deformities are forming, then we have to consult surgeon by doing multiple investigation, doing MRI, X-ray, or find depends on finding whether we need a particular removal of or excision of plantar fascia, then we can move forward. But usually doctors or surgeons doesn't suggest any kind of surgery for plantar fascia as such.
Okay, that's very enlightening. So, Pramila, I hope you have understood that surgery is not required for the treatment of almost all patients with plantar fasciitis. It is in very rare situations that surgery is required for the treatment of heel pain or the treatment of plantar fasciitis. So, we discussed about exercises that patients can do at home, and you showed about the plantar stretch that patients can do, and they can also the tests that they can do to see their ankle mobility. Is there any other exercise that you would recommend that patients can do to help relieve their pain and problem if they're having some mild plantar fasciitis? Some exercise that they can do on their own.
Yeah, absolutely, sir. We are having very easy exercises which all the viewers can do if they are having any heel pain. Then they can start doing this exercise at home, and it is very easy and very minimal, equipment we need for that. So it is very doable at home. So first exercise and most important exercise I can say is just a second. I'll share a video of that so it will be easy to understand. Okay, so now I'm starting this video. This video is about plantar fascia release. So plantar fascia, as I discussed or showed in anatomy video, it is starting from base of fingers and it is attaching in the calcaneum over here. So we have to take a firm ball, or we can choose one hard bottles like glass bottle or some water filled bottle, also some other heavy round shape structure which we can use to use over exactly over here. We can put some body weight and then we start moving it around. So it will release your plantar fascia. So usually what happens if it is irritated, it will be tight. So we have to release and make it little smoother to take whatever load or whatever thing is happening over there, that irritation is happening, that will reduce because it is little soft in nature. It is not that much tight.
So how many, this is a very simple exercise. I'm sure everybody can do this at home. So how many times should they roll it, and how long should they do the exercise? Generally, what would you recommend?
So as I mentioned before, also before showing that stretch, which is you can do in the morning before you start walking to reduce the morning pain. Same thing you can start doing this also, which will help you further because this is stretching as well as rolling. Both will improve your this plantar fascia thickness or whatever tightness is there. It will reduce and it will reduce your early morning symptoms while walking or pain. And after doing running or jogging kind of activities and you are getting this heel pain, then also you can start doing this to, give you quick relief from the symptoms.
Okay, so that is a very interesting point. So, especially runners and marathon people and all of that. So, after running, if they experience any kind of, and I trek, so even after trekking, sometimes I experience heel pain. So, that time we can quickly do this rolling exercise with a water bottle or a ball, and that should help with respect to reducing the tightness in the plantar fascia, right?
Yes, absolutely.
Okay. So, any other things that you would recommend to,
Yes.
either exercises or any preventive aspects that you would recommend to people who might be having plantar fasciitis?
So till now we discussed two, three things. One is rolling, one is stretch for plantar fascia. Third thing we discuss is modification in this footwears also can help. Reduction in the weight also can help to reduce all the symptoms. If you are, having overweighted body, it will again put a lot of pressure on the plantar fascia and it can give you irritation. So if you are reducing weight, that irritation will reduce because your weight is not bothering that plantar fascia. So that also we can do. And there are some corrective exercises. If you are meeting any qualified physiotherapist nearby, they can assess your whole biomechanics. If your so plantar fascia doesn't arise directly because it is irritating over there. So sometimes muscular imbalance can change your joint angles. So your joints are moving in particular range and particular angles while doing certain activities. So if your joint is not moving in particular direction because your one side of muscles are tight or weak, then we have to address. So if you are meeting physiotherapists, they can do multiple tests. They can check your muscle strength, your joint integrity, your joint range of motions. And according to those findings, they can give you a tailored exercise program. So if you are doing those exercise program, which is tailored, because many reasons are there. If your knee muscles are weak, if your hip muscles are stiff or hip joint is stiff, that also can alter your ankle mobility or ankle structure. So that also can lead plantar fascia. So we have to address particular reason and basic basis on that particular reason, we can give tailored exercise program which can help you further. Because generalized exercise usually helps, but that will there is no particular reason we are finding out because of what reason it is coming. So to address the reason, you have to meet first physiotherapist, then you can start working on your tailored rehab program.
Excellent. Thank you so much, Dr. Shivraj. That was very enlightening. And I hope that has helped clarify to everybody who's watching how they can go ahead with the treatment of their plantar fasciitis if they have. Bharat is asking whether steroid injections provide relief. So we discussed all this, Bharat. You can just rewind the video a bit and see that we had discussed about a local injection of steroid. Yes, it can provide relief in the by reducing swelling and inflammation and thus by reducing the pain. But you need to understand that medicines or injections are complementary to what all other things that Dr. Shivraj just mentioned. So exercises, orthotics, weight reduction, this is the main treatment, and medical management with either medicines or with local injections, either corticosteroids or platelet-rich plasma, are just supportive therapy to try to reduce the pain and swelling for a certain duration and to help you to get started on the exercise program. So we are already 10 minutes past the schedule. I think that was a very enlightening talk. I think we have covered about the causes of heel pain, which is causes of plantar fasciitis, and how it occurs and how it impacts your daily life. What are the things that we can do to sort of take care of plantar fasciitis if it is mild or if it is we are having problems which just started. Then we can, there are certain exercises that we can do, and you showed those exercises also. And if you are having plantar fasciitis for a very long time, then you definitely need to meet a physiotherapist so that they can assess why the plantar fasciitis is coming, which muscles are weak, which muscles are tight, what is the how mobile the ankle is, how it is able to move, and all of those things. And we also discussed how medications can be used as well as injection can be used to reduce the swelling and inflammation temporarily, and therefore reduce the pain and help you to get started on the exercise program. And you also mentioned how surgery is used only in very, very rare situations, and most patients with plantar fasciitis do not require surgery. So with that, I think since there are no other questions also, we can end this session. So I would like to thank you, Dr. Shivraj,
Thank you,
for
sir.
coming
Always.
on today and enlightening all of us regarding plantar fasciitis.
It's my pleasure, sir. Thank you.
So
Thanks.
I hope after this program, everybody's heels are healed.
Absolutely. Thank you.
Okay. Thank you, everyone. And please tune in to our next live discussion, which is going to be next month, usually on the 15th. Bye. Good night.